Good afternoon. As the Quality Management Specialist with HCS, it is my privilege to introduce the Provide Unified Eligibility session led by Safri Diawara, Clinical Quality Management Coordinator, Kimberly Ely, Assistant Director of Medication Access, Jonathan Albright-Williams, Ryan White's Grants Manager, and Ashley Yoakum, HIV Care Services Planner. We will hear more about recent developments regarding the Provide database and updates on unified eligibility. First up, we have Safri Diawara.
So thanks, Camelia. So we're going to talk to you a little bit about the Ryan White Unified Eligibility. And like you know, Virginia Ryan White HIV Care Program. And the mission is to coordinate some culturally competent medical and support services throughout the state, and also to enable people with HIV to successfully navigate complex health and human services system, and to increase and sustain self-sufficiency and overall improve their health outcome to give them quality of life. So what's the background of the unified eligibility? I'm going to give you some background information. So the program just focuses on getting all the support and core services we are providing to be compliant with states and national guidelines, and also to improve people access to care. But Virginia has been, very low in reaching the EDAP recertification rate, which is a little below to the national benchmark. And EDAP is the Aid Drug Assistance Program. So to address that, VDH has conducted numerous eligibility efforts in the past. We started in 2015 and to develop the case management standards. In 2018, we implemented several quality improvement projects and to assess and improve our EDAP recertification rate. And 2018, 2019, and our Virginia Consumer Advisory Committee, the VACEC, did a good job in educating consumers, their peer, on EDAP. So in 2020, and we tackle, adding a new database called Provide Enterprise. And the data system will help us to streamline the eligibility process for all involved. And 2022 will be the year of the implementation of the unified eligibility as well as the new database Provide. This is just a data showing you what was our effort in 2018. So we work with our partners, the Eastern Virginia Medical School, and to implement a joint eligibility processes, and with the Ryan White Part A, and also with the Ryan White Part C. That was a cohort of a patient we take for the 12 months, and you will see the baseline, and for Ryan White Part B was 35, and by the end of the year, in January 2019, we were able to improve the recertification rate from 35 to 78. For the cohort of the Ryan White Part C, we started with a baseline of 65, and was able to improve the rate by 85 by the end of the year. So what the data is telling us, and it's telling us that we can be able to improve the recertification rate. And the QRP, and also was supported by some communications, process improvement, education opportunities, and partnership with our sub-recipients, and to see how to implement the joint eligibility. We had a recommendation from the Quality Improvement Project to keep working closely with our partners on the eligibility and recertification rate improvement, and also to keep using the EDAP list we send to our sub-recipients and through the portal, and just telling them those are the clients who need the recertification and communicating the due date to them. Now, that was the background. And let's just see what's the unified eligibility implementation will look like. HRSA just released policy clarification 2102 and on the determination of clients' eligibility and payer of last resort in the Ryan White program. So that gives some flexibility to the state, and it requires some periodic check of the Ryan White program to identify any potential changes that may affect eligibility. So that remove the mandatory 6 months recertification and allow also Ryan White recipients and sub-recipients the flexibility to timely conduct eligibility confirmation. So if we were at 6 months, and this policy clarification is giving some flexibility to the state to think what is good for them. And the immigration status shouldn't be included on any of the Ryan White eligibility and the determination processes. So what is unified eligibility? So we think unified eligibility is a process to assess people eligible for Ryan White program, including our Virginia Medication Assistance Program, through one assessment and application according to the established Virginia Ryan White Part B requirement. Nothing will change with the eligibility requirement, but all the eligibility will be done through one portal. That's gonna be the big difference. And we're gonna do the client's access review, and that should include assessment of changes in the income, residency, and insurance coverage. So after giving the definition of the unified eligibility, I will let Jonathan Albrecht Williams and to give you more information on the unified eligibility. Thank you.
So thank you, Safri. I want to begin with helping us all calibrate to this new process. Although the unified eligibility process is built on our current process, there are new updates that we have established to improve the quality of access and care for our Ryan White clients. We will start with a foundational or basic understanding of unified eligibility. So when we're talking across our HIV care service delivery system here in Virginia, we are all speaking the same language. Things like terms and goals are to really help us conceptualize implementing this into our everyday system of care. You heard the definition from Safri as it's displayed on the screen on what unified eligibility really means. And you really can think of it as one door that clients open to access all Ryan White Part B services. So simply put, there will no longer be an ADAP application and a separate application or eligibility intake at the subrecipient level. Unified eligibility does combine eligibility assessment into one process. So let's talk about goals and the impact of the unified eligibility. These really speak to the heart of VDH reaching the decision to unify our eligibility process. We have heard from you, our subrecipients, and our clients, and even our own Ryan White staff, that we need a simpler way for clients to access all services. So here are some of those goals that unified eligibility really brings to us. It allows us to have timely processing of client eligibility. It ensures us for timely access to a client's timely access to all services, including medication access. It avoids duplication of efforts for both the central office through VA MAP and our Part B subrecipients. And ultimately is to optimize health care outcomes and prevent new infections in our communities. The benefits are really threefold, and they really address the administration burden, client burden, and information sharing. Through unifying eligibility, we are reducing the heavy load of a dual eligibility system and looking to improve client access and even data sharing with our subrecipients. So we see here, there's some real tangible benefits for unifying our eligibility. Most of it deals with, as I said, the administration burden and client burden of having to do multiple applications throughout the year. Unified eligibility allows us to streamline as well as share data in real time with our subrecipients regarding our client's eligibility. So let's dig into some common terminology you will hear moving forward under unified eligibility. First off, unified. It simply refers to a process of combining separate eligibility verification for ADAP and another eligibility verification for all other Ryan White Part B services, and rolls it all into one assessment that's done on behalf of the client. Eligibility assessments. It simply refers to the process to verify a client being eligible for all Ryan White Part B services by meeting all of our Part B client eligibility criteria. And we'll refresh that in a minute. Client access reviews, or CARs, it refers to the periodic checks for enrolled Part B clients to identify any potential changes that might affect their eligibility. Case managed. This refers to clients that are assigned to a medical case manager or a non-medical case manager who then helps the client access other all Ryan White services as needed. And then you will hear the term not case managed. And this refers to clients that do not currently have an assigned case manager to access any of the Virginia Part B services. This usually happens when a client only is accessing ADAP services through Virginia MAP. So these are some terms you will hear throughout the rest of this presentation and implementation of the unified eligibility process. Next, we will discuss guidelines that are really to help us steer our unified eligibility process into being successful. So as I said, first things first, defining eligibility. Nothing here changes for us under the unified eligibility process. It's the same one that we have heard throughout the years for our clients to be eligible for any Ryan White services that included in Virginia MAP as well as at our subrecipient level. And so clients must continually meet the Virginia Part B eligibility criteria and all the conditions at all times for their service. Verification of HIV positive status that they will only have to provide once at the enrollment. Verification of residency in the Commonwealth of Virginia. Verification of household income of equal to or below 500% of the federal poverty level. And proof of insurance or other insurance coverage, including Medicaid assessment. Now let's look at what does change beginning April 1, 2022. All persons receiving any Part B service must have their eligibility assessment completed by a funded Ryan White Part B subrecipient. This is a change for both our clients and our subrecipients. And we want to support the process of ensuring clients are able to access all services they need for a better health outcome. Our goal is to not have clients fall through the cracks, and the way that has been proven most effective is by having our subrecipients being that door for clients to access all services. Secondly, subrecipients will conduct full eligibility assessments every 24 months. I will pause for the virtual applause. But what this really does, and if you remember what Safri mentioned about PC 2102, this allows the flexibility where we are able to implement and lessen the administration burden and really put client care at the center of our focus. And so this means that our subrecipients will have to do a full eligibility assessment every 2 years. Our new client level data system will be able to help with this monitoring. And lastly, subrecipients should conduct client access reviews, or CARs, which I will talk about in our next slide, on a periodic basis to identify any potential changes that affect eligibility. And most critical here is to report all changes and provide the supportive documentation and provide. So let's explore the CARs a little bit further. Remember in HRSA PCN 2102 that entitled Determining Client Eligibility and Payer of Last Resort in the Ryan White Program, it states that it requires periodic checks of the Ryan White program to identify any potential changes that may affect eligibility. So our subrecipients will have to do regular checks to ensure compliance with Ryan White's program's policy and eligibility. VDH will also do periodic checks to ensure compliance and changes are documented in our Provide system. And we will hear more about Provide that will help both VDH and subrecipients have access to the same client information throughout those 24 months of eligibility. VDH asks that you do these CARs or periodic checks throughout the year until the next eligibility assessment is due. Remember, full eligibility assessments are now due every 24 months for clients. Any changes between that all must be updated and sent to VDH with supportive documentation in our Provide system. Next, CARs can be completed when you have any contact with clients for service planning, service delivery, phone calls, or visits conducted by outreach staff, etc. And you can really think about this every time you yourself go to visit the doctor. They always ask you, has anything changed? Has your insurance changed? Your address changed since the last time you visited us? And that's really what CARs are for us with the Unified Eligibility. It's really to access if there has been any changes to our client's eligibility status. And a last thought on CARs, just think of them as the vehicle for clients to keep their eligibility and access to care for the best health outcome. So now I'll turn it over to Safri to help us drive home the unified eligibility.
So thanks, Jonathan. We'll just keep giving you more information on the unified eligibility. And we will have two groups of patients. The first one will be those are case managed clients. Those are clients who are already receiving medical case management, non-medical case management, or are receiving other services, Ryan White services, and through funded agency. So the eligibility will not change, and it's going to be in the same process like you're doing now. And we have a second group of patients. Those are the clients who are not case managed now. They're not getting any services through your agency, but they are like self-managed, they do their eligibility by themselves. Because now it's going to be mandatory for them to go through an agency, and they're going to be requesting some assistance from you. And the assistance can be provided by case managers, by intake specialists, by social worker, and whoever can help them to assess and to complete their eligibility. And those services will be also recorded under the psychosocial services in clients data recording. So when you got the request from people to help them with Ryan White eligibility, we just encourage, asking you to accept those requests and work with the clients to collect all the needed information, documentation, and upload them under the Provide enterprise. And you're going to use the electronic intake and eligibility form. So subrecipients will complete and document all the established eligibility determination. And also you need to review the requests and truly review all the documents before you upload them into the Provide. And like I said, clients who are not case managed and coming to the site just for the eligibility application assistance, you can record those services under the psychosocial support services. Every client who complete the intake process will have also a sign and the consent form on the system. Continuation of eligibility. And like Jonathan said, we're moving from 6 months of recertification to now 24 months of eligibility time period. So the full eligibility will be done every 24 months. And in between, you need to do the client's access review. And like you said, like we go to the primary care doctor, I just asking you, what about your residency, your insurance status? That's what we are asking people to do. If you identify any changes, then you need to collect the document from the clients and upload them into the Provide. Please use a reminder system in place and to assist with contacting clients who are nearing their client's assessment due date. Provide is the good tool. If you go to the Provide, you will see when the eligibility is due. And I will say 6 months before you need to start getting a plan how to get in touch with those clients and be sure their eligibility is not outdated. And the conduct card, the clients access review at least once per year or at all the encounters. That's the best practices. Anytime clients is in office, please use the opportunity to assess about the eligibility status. And you can also develop and put a system in place to conduct follow-up with clients who don't complete assessment on time. And you can use also non-MAI outreach services category for that. And you have several options to help you with the clients and access clients access review. So that's briefly the end of the update on the unified eligibility. And we're gonna move forward to provide some information on the Provide enterprise system. Kimberly Ely, the Assistant Director for Medication Assistance at VDH, will provide some information on the Provide enterprise system.
Thank you, Safri. So I am going to give a little information about the Provide system, and Ashley Yoakum will also give some information regarding Provide. As mentioned, Provide Enterprise is our new client level data system. I'm going to give a general overview of the Provide system, talk about our implementation phases, and then Ashley will talk about some of the advantages to the Provide system and give you some resources. So this new client level data system, we procured from a group, a vendor called Group Rare Technologies. They have been working hard in building this system out for us for quite a while now. This system will be used, as referenced earlier, for our Ryan White Part B eligibility and tracking of Part B service data. This system is replacing prior systems that we've used for capturing our service data. As most of you will recall, we had a system called E2 Virginia, and some of you have now been using RedCap for capturing your service data. The Provide system will replace both of those entities. Provide is also going to be replacing the system that we use in ADAP called Contacts Database. So now this one system houses all Ryan White Part B services, including ADAP. The system allows for electronic submission of eligibility applications, and they are now known as assessments in the Provide system. So the applications and the supporting documentation can be submitted in this electronic platform. There will be other programs within our Division of Disease Prevention that will also use the Provide system. So please be on the lookout to see modules for Charlie services, status neutral, PrEP, data to care, and rapid start. All of those will be in the Provide system as well. Let's talk a little bit about implementation, just to give you a review of it. We have been giving updates about implementation over the last year. Just to recap, implementation began in November of 2020. There are 3 implementation phases. Our estimated timeline for our implementation phases covered a period of time from November 2020 to March 2022. We have had a couple of delays in our implementation process, so that may get extended past March of 2022. So in phase 1 of the implementation, we focused on creating the foundation of the system, what is known as the client profile. We also focused on setting up all the VA MAP components in the system. So phase 1 go live occurred on August 30th of 2021. At that time, our VA MAP team has been able to utilize the Provide system to process assessments. These assessments were submitted by our subrecipients through the web portal. The Provide web portal provided a way for subrecipients to submit the information to us while we wait on the implementation of phase 2, when they will have direct access into the Provide system. The Provide web portal is still accessible at vacare.providecm.net. So any agency that is not able to utilize the Provide system can still use the web portal to submit assessments. But most agencies have received access to the Provide system in phase 2. They are now able to enter assessments and do data entry for their services through the system. Phase 3, which we are just starting, will focus on implementing other components like our Medicaid back billing, incorporating more reporting elements, as well as some final pieces to our status neutral and data to care program. Now I'm going to turn it over to Ashley Yoakum to talk about some of the benefits.
Thanks, Kimberly. Now we'll talk through some of the benefits of the Provide system for our subrecipients. So as we mentioned earlier, the system will allow for the electronic submission of all eligibility assessments for all Ryan White Part B services, and it will also allow for the upload of necessary documents required for eligibility assessments. And then based on the assessment and the required documents, the system will actually calculate the eligibility for the client. And so being able to have client eligibility and service data in Provide should allow for subrecipients to move away from paper-based client files. The system will also allow our subrecipient staff to see information related to a client's medication access services within the system, including what VA MAP program they have been enrolled in if they are enrolled in a VA MAP program. And lastly, subrecipients will be able to share information between clients if either the clients move to a different agency or if there are clients that receive services from multiple agencies. So you will no longer have to send eligibility paperwork between agencies. You will be able to now see it within the Provide system. Okay. And now a few benefits of the system for VDH Central Office. Similar to subrecipients, this system allows our VA MAP staff here in VDH Central Office to move away from having paper-based client files as everything will now be housed within the Provide system. As well as now that subrecipients will be completing eligibility for all of our Ryan White Part B services, including medication access services, as well as having the system calculate eligibility for our clients automatically, this will allow for our VA MAP staff to be able to focus on arranging logistics for medication access for our clients. The system will also allow for direct communication with both providers and consumers regarding their eligibility status and VA MAP information. Lastly, this system will now house data from multiple DDP programs, making it easier for VDH to utilize our data to inform decisions and planning purposes for the future. And lastly, here are some resources available on the Provide system. VDH has created a dedicated website for Provide resources. The setup is similar to the DDP REBCAT page on our VDH website. Resources available on that website include Provide installation instructions, links to all of our recorded trainings, manuals created by Groupware Technology for the system, any user ID request instructions, Ryan White service report or RSR guidance, as well as any other pertinent updates to the system. We have also created a dedicated VDH email for all Provide questions, as well as any additional support needed for utilizing Provide. Lastly, for any technical or software questions regarding the Provide system, we have also included contact information for the Provide help desk that's run through the Groupware Technologies. Okay, and now we will move on to the live session for questions and discussion. Thank you. All right, and so now we are actually going to do some polls first, based on information that we just provided. And so if you go to the polls section in the CVN event, you should see, I'm going to open up the first poll now. So you should see a poll for regarding unified eligibility. And so we want to know, based on the information that you've heard so far on unified eligibility, do you think that moving to this process will actually help our eligibility compliance, as well as improve access to care for our clients? So we'll give it a couple more minutes for other folks to respond. All right, so far about, well, we still have responses coming in. All right, right now it looks like about 75% do think that moving to unified eligibility is going to help our compliance as well as improving access. 15% aren't sure yet, and about 8 no. So I'm going to go into the next question, but you can still continue to answer the first one. Oh, which looks like that one was already opened. So with the next question, we are wanting to know what you think of the 24-month time frame. So whether you think that's a good enough time, if you think it should be longer, or if you think it should be shorter. But remembering that we want to try and not create barriers for our clients and really give them enough time to be able to access services. All right. And so now with the next couple of questions, we're going to move on to some questions related to the provide system specifically. So if this one we're asking, and I know we've asked this a couple of times, but we're trying to continue to do check-ins to see if people are able to access the provide system as well as log in successfully. And there is an option for those if you don't utilize the provide system to select that one. Okay. All right, and so now with the next one is, do you understand how the provide system will help with unified eligibility? Oh. All right, so we're going to go on to the next one. So this one is going to ask about training. So this one's asking if you have attended one of the provide training webinars, two of the provide training webinars, or if you've attended all of the ones that you could take that are applicable to the programs that you work in. Right, does seem like a good number of folks have attended all the webinars, so that's really good to see. All right, so now we're going to move on to the next one. And so this one's just asking in general how you feel about using the system. So whether so far it's been easy for you, if you still have some questions, or whether or not it's been difficult to use, you do not use provide, or if you've asked for access, but you're still working on getting it yet. All right, and then we're going to move on to the last poll question. So this one's going to ask about just what information you all feel you need to help you with implementing unified eligibility. So whether that's more training on helping those clients who may not be case managed, more training on the actual provide system, more staff to assist with client assessments, or all of the above. All right, so thank you for that. These will help us kind of plan more trainings and more information to provide as we get closer to that April 1 start date of moving towards unified eligibility, as well as continuing to work to get everyone into the provide system and acclimated with that system. So we're now going to move on to some open-ended poll questions. So this is where you'll be able to actually type in some responses. So if you go to, and you'll be able to see the questions on the screen. So if you go to poll, POLLEV.com/B Williams, that's BWILLIAMS 707. And you should see the, you can also see that at the top of the slide. And you should be able to go there and actually enter in responses. Try to keep the responses to about 1 or 2 words just to make it easier for them to appear. And so the first question we're looking at is if there are any anticipated advantages that you see in moving towards unified eligibility. All right, so we're starting to get a couple in. Right. So more responses are coming in. So far, it looks like less in time and less paperwork seem to be the overwhelming advantages that seem to be coming up so far for folks. All right, so you can still enter responses. We are going to go ahead and move on to the second one. All right, so at that same site, now what are some possible and anticipated challenges in completing eligibility assessments for those clients that are not case managed? And again, this will work best utilizing one-word responses. And so again, this is going to be anticipated challenges. All right, so the big one that seems to be coming up so far is contact and paperwork. So it looks like, yes, so maybe making contact with some clients who aren't regularly in touch with your agency. Looks like forced is another one I'm seeing quite often. Give it a couple more seconds and then we'll go ahead and move on to the next question. We have two more. Yeah, it's looking like paperwork, contact, and forced are the big main ones I'm seeing. So we'll go ahead and move to the third one. So now kind of switching gears and going back to provide. So what challenges have you encountered in either accessing provide or logging into provide? And again, these really work best with the one-word responses, and this will be able to give us a better idea of what we need to work on. And these can be either challenges that you're currently encountering, or if they're challenges that you encountered early on. Kind of waiting to see if there's one that pops out. I am happy to see that in some cases there's none, which is really good to hear. In other cases, I'm seeing duplicated data. Firewall is a big one, it looks like. Yeah, I think the big one is going to be duplicated data and firewalls. All right, and then we're going to move into our last one. And so kind of similar to some of the poll questions, what additional training needs do you need, either in relation to unified eligibility or the provide system? All right, looks like a mixed bag here. Looks like documenting, some still need assistance with accessing. I'm seeing outreach to clients. Manual seems to be a big one. So do remember, you can access the manuals for the system on our provide website. And there's the big manual, and then there's actually manuals for each program. Looks like information access is still a big one. All right, so thank you everyone for engaging with us in these polls, both in the multiple choice ones and in these word cloud ones. These will really help us as we move forward, as I said, in continuing to get people access to the provide system and making sure everyone is trained in it and knows how to use it, as well as we move forward with our unified eligibility. And now we are going to go through some of the questions.
All right, good afternoon. So there is no shortage of questions here, so everybody buckle up. All right, so the first one to come through, how will agencies learn about clients who are not case managed?
So the information will go out. We have started and communicating through the Virginia Consumer Advisory Committee, and we are planning the train of trainers. So we're gonna take the leadership of the VCAC and train them on the unified eligibility and the provide. And we're gonna also take the road and virtually and to train the regional consumers on that. So that's the approach, and we are planning more brainstorming, meetings, and to look at deeply about the group, not only reaching out about how to monitor the eligibility status during the 24 months.
And I will add on to what Safri was saying. In addition to that, what we're asking our subrecipients to really do is to make sure that you are updating your information on our Resource Connections website. That is something that we're asking you to heavily advertise so that folks who are looking for services or an agency to be able to access Ryan White services, they'll have your most updated information. You all received this the link to this website a while ago now. So we're really going to ask that you all update the information on that Resource Connections webpage. We also have partnered with the DIS, Disease Intervention Specialists, who also have our ADAP wallet cards that has the website and the link and the QR code on the cards so that folks can also be able to access that information when they're trying to be linked to care. So if you all will make that effort to partner with us to making sure that information is updated, that's another way that clients will be able to access services in the area if they are not case managed.
Great.
You are muted.
I'm muted. Yes, thank you. Will the agencies need to reach out to clients in their area who are not case managed? Will we get a list of people in our area to reach out to?
So as Safri mentioned before, we're still working out those details and really looking at the data of those clients that are not currently case managed. We do not have, I would say we do not have a running list of all the clients that are not case managed. Again, a lot of this really, what we're looking at is our clients who are in VA MAP that are not case managed, because that's where a lot of our population who this will impact the most, as we see in our data. And so right now we are looking at all the different ways to be able to access them and partner with the subrecipients and agencies to see how that they can become available and what information that we'll be able to share with you all to capture all of the clients in this new process.
Thank you, Jonathan. Okay, and what about clients in rural areas of far Southwest? Will they now be required to physically go into agencies that may be hours away from now? I'm sorry, hours away now to sign forms?
No, and we're making it easy for people and how to communicate the information to the providers. They can do screenshot, they can share their information through any phone screen, and those are type of flexibility we put in there, and people don't have to be physically at the agency, mostly at this COVID time, or because of the rural area. But anything innovative way to collect those information from the clients, are welcome. There's no one way. And we're asking also all the sub-recipients, providers, and to work with VDH and to bring some best practices how to handle a situation like that.
Okay. And next, would every client need a new full assessment to begin the 24-month period beginning on April 1st, 2022?
I will say, yeah, Kimberly, go ahead. That's how I say Kimberly. Go ahead.
No, every client will not need a new full assessment as a 4-1. We're currently looking at some options regarding the dates, since we have so many assessments already in the system, and essentially it will count as their eligibility for Ryan White Part B services. We are looking at whether or not we will allow those that have already been submitted one over the last few months, that those will count, or if we will start, as of 4/1 and everybody doing one within the next 24 months. So as we kind of talk some things through with that, we'll start sharing more information about that over the coming weeks. But I'm thinking we probably might actually take we're looking at all of those things that have come in since we went live and Provide, and count those in that 24-month cycle. But more information will be coming.
Thank you, Kimberly. Can outreach workers check eligibility if they are EIS clients and agency does not provide medical case management or non-medical case management services?
Yeah, VDH doesn't direct who need to do the eligibility because it's depend on the agency capacity, resources in place. We have some big agencies where they have individual staff member for each of their area of services. They have eligibility staff, they have non-medical case manager, they have medical case manager. But in small agencies, for example, you will see just one person doing all these activities. So we're encouraging this, all the site providers to look at the resources, and whoever is assigned by the agency to do the eligibility is okay. Early intervention stuff, and if they can go like within the car, is clients, access review. Any contact, any encounter with us, we can use those to check on their, residency, income status. And if we find out that something had changed as early intervention, services provider, and you can direct them to the right person and to complete the update of their eligibility status.
Thank you, Safri. Do we need to have formal documentation of a CAR being completed? Is putting in a progress note enough, or do we need to have a formal process of telling the date of each CAR that was completed?
Yeah, we haven't, finalized that, but I will say progress note is fine. The matter is not the documentation. The matter is being sure the client's access to care and their eligibility status is up to date. If it is just a single note on the progress note, you think is your documentation at the agency level, we are okay with that.
And as Safri said, we are still looking at that, but keep in mind, if a client comes in and you're completing that CAR and there is any change in any eligibility component, they got married, the address changed, they have a different insurance, they're now, in Medicaid, if there is something that's changes in income, those things actually need to be entered in Provide. You need to do an update to their assessment record.
All right, thank you. All right, and next question. How will agencies that use Careware implement Provide requirements without having to enter data in every system?
I can take this one. So there's two components of Provide. There's the eligibility piece, which every provider will need to put eligibility for clients utilizing any Ryan White Part B service. So that will need to be in Provide. The second component is the client level data entry. So for our agencies that utilize Careware for their Ryan White Part B client level data, you will still put your data into Careware, and then that data will be imported into our Provide system. So similar to the system we had before Provide, where you all would enter your data in Careware and it would get imported in. So at the moment, you will still continue to upload your careware files to the share folder, the STFP folder, and then it will be imported into Provide. We will eventually like to get to the point where providers are able to import their own careware files, but we're still working on that process. So at the moment, you will still do your client level data into careware, but you will need to do the eligibility piece for all your Ryan White Part B clients into Provide.
Okay, it looks like we have a question that's piggybacking off of the careware and Provide. Does Provide integrate with careware at all for RSR purposes for agencies that have Part C or D? Or do we need to duplicate data to be able to get RSRs to both HRSA and VDH, various parts of Ryan White and multiple contracts?
So remember that agencies will only run one RSR report regardless of how many parts you have. So if you have, for example, Part B, Part C, and Part D, you would still run your RSR in your careware. And then you would submit that through the electronic handbook for your agency. Now for agencies, this one only talks about careware. So yeah, so you'll still continue to do your RSR in careware just as you've always done. And it should incorporate your Part B services. And then if you have other Ryan White parts such as C or D, it would incorporate that as well. But then you would only submit. So if you're getting an error message when you're trying to complete your RSR, if you could please send an email to both myself as well as to Kim Hunter, whose email I will need to pull up because I don't have it off the top of my head, and a screenshot of the error you're getting so we can try and determine what the issue is. So Kim Hunter's email is khunter@vcu.edu. So if you just send an email to myself and Kim Hunter with the screenshot of the error you're getting, we can try and either determine what the error is, or we may need to send you to the careware help desk, but we will look into that if you're getting errors.
Okay, and that was just in reference to the question about error messaging and knowing if, if everything has been entered and received. All right, so thank you, Ashley, for answering that question. All right. Let me see, next one. Can Charlie managers start implementing info and to Provide if they have access? If they have access to Provide.
The answer is yes.
Thank you, Safri. I'm just trying to catch up here with all these questions. Everybody has got some good questions here. All right. Next up, is there an anticipated time for careware data importation into Provide?
So we do not have an anticipated time frame for when agencies will be able to import data directly into Provide. No.
They've been importing data into the red cap. I'm thinking it's going to be the same cycle, right?
So right now, agencies will continue to upload your careware files into the SFTP folder, as you've been doing, and VDH will import those into the Provide system. We don't currently have a time frame though for when agencies will actually be able to import your own files into Provide. We are still working through that process and want to make sure we understand how that will work and all the components of that before we have our agencies do that.
Thank you. All right. Will the consumer access provide to update their eligibility, including uploading documentation, and who will provide training on how to use the system?
Yeah, that's one of the changes. All consumers need to go through a funded agency to get their eligibility process. All of them, no exception.
Okay. All right. Somebody has mentioned that they have emailed provide for technical assistance 3 times and they have not heard back. Is there a preferred method for contacting?
You emailed GTI's provide line, or are you saying you sent an email to the VA provide line? Which one?
Let me double check. It looks like it was the Virginia provide. It disappeared. There it is. Yes, it was the Virginia provide at VDH.
Okay. So whoever has is indicating that they've sent something to VA provide at VDH and have not received a response, can you please send it again and copy myself, Kimberly Ely, and also Ashley Yoakum? And we'll just make sure that you get an answer from VA provide regarding your issue.
Okay. So we got our next question. Non-case managed clients don't go to VACAC events. Using the VACAC won't work to reach non-case managed clients. I don't know if that's a question, seems more like a statement.
Yeah, I disagree with that. I was on a meeting yesterday with a room full of consumers, and some were not even receiving any Ryan White services. And they have many there who are not case managed. We connected a couple of them to the Vernon J. Harris case manager, and he's planning to contact them today to see how to, assist them with their need. Yeah. We know we have some clients are not case managed, but saying they are not attending VACAC, it's a little challenging, and statement. Some are attending. And the question is how to reach out to those who are not case managed. We already answered the questions. We're working on it. It's not one side, effort. We're asking sub-recipients and the consumer leadership and to work with us to, find the best practices, how to reach out to the group, to inform them, to be able their eligibility is done, but also to monitor their eligibility status during the 24 months.
Thank you, Safri.
Yeah.
Okay, and the next question, how soon will patients' data be transferred into the new system?
I think the historical data is already transferred. Ashley, can you add anything to that? The data, the historical data for the past years and until December, I think it already been transferred to the provider.
Yes, so we have imported our all Ryan White data for calendar year 2021, with the exception of our December data, since we cut off that as of 11/30. And I believe it also has 2020 data as well. And so now agencies, you will need to, if you are a direct agency who needs to enter in your December data, That's what you should be working on now as soon as you're getting access to the system, so that when you run your RSR, you will have a full year's data. And then it'll just be entered as you, as you enter it, you should be able to see it.
Okay. How long does it take for a client's approved assessment to get uploaded into the Provide database?
I'm not sure that I understand the question. Once assessments are actually put into the system, they're there. There's nothing to upload. So they're there for review and approval. If the question is how long it takes to get an approval, that depends on what's in the assessment. If there's no issues or concerns with the assessment, what we would like to get to is a point where it's actually turned around in our time frame of 14 days or less. With our limited staffing right now, that has been a challenge. So the staff has actually been doing overtime hours to try and get through a lot of the assessments that are there. I will say there are quite a few that are rejected at this point. If in checking your assessment, if you've received notification as you use your confirmation numbers, or you've had outreach from a VMAP team member that has been rejected because of missing information, please work with them to get whatever that is or clarify whatever is needed so we can move those out of that rejected status. But ultimately, once everyone is in the system and everything is kind of working the way we envision it, it should not take more than the 14-day time frame. Honestly, it should probably take around, our goal is to have it take 5 or less, but we got to get there first.
Well, just want to give a quick shout out to the Virginia MAP team, because I know y'all have been working diligently, not only trying to continue the service, but also with Provide and making sure that calls are answered through the call center. So much appreciation to the Virginia MAP team. Okay, for the next question, if something changes with a client and an update is completed, does that start their 20-month period over from that point?
No. So let's say that assessment is put in, a brand new assessment is put in for a client, and it is February 1st, 2022. In this 24 months, they are not going to be due for another full assessment until February of 2024. So if in January of 2023, client comes in, you complete the CAR, and they have now moved, they have a different address, different telephone number, you're simply going to do an update and Provide. We have just notified GTI that we're going to be requesting that they make an adjustment in the system currently. If some of you remember when we first started the conversations about Provide and giving you guys information, we told you about how it was set up so that eligibility basically would expire every 6 months, just as it's stated in our program right now. However, we didn't turn that functionality on. It's programmed in there, but we hadn't turned it on to actually remove anybody from services because of that reason. So as we move to this 24-month period, the same principle is going to apply. We're going to have them program it so that from whatever date that we decide upon, but in my example, it would be 24 months from February 1st, 2022. So February 2024 would be the time the next eligibility is due. Anything in between that you put into the Provide system is going to be looked at as an update. It will not count it as a new assessment. It's just going to count it as an update to the record. So if you're updating in that example I just gave, where it's a different address and telephone number, it just puts that information into the client record. It's not going to start the counter again. It's just an update to the existing eligibility that's there. The full eligibility update is going to be due February 2024.
Okay. Some of the data is exported to provide from carrier, but some fail to do so. I'm unsure why, and that is one of the biggest obstacles we face. How can we address this issue?
I think it's a working process, and people need to be a little flexible with any database, mostly a big statewide database like this. So the implementation take plan, do, study, act. That means you try, you retry, you find, you redefine until we got the good product at the end. So there is some glitches can happen, but the communication is the key. Anytime you have things like that, please communicate to the right people, and so they can help you and take note if some changes need to be made to the system, they will do it. We are implementing, like Kimberly Ellis said, we have phases of implementation. And that means we're making some changes as we move along and as we get feedback from the stakeholders.
Okay, thank you, Safri. All right, and we have a two-part question here. Someone is confused with the 12-month and 24-month eligibility. Can you clarify? And the second part, these changes in eligibility have nothing to do with the case management assessment and acuity level of care via case management standards. Is that correct?
Yeah, I'll start with the case management. Nothing will change with the case management. Medical and non-medical case management is not the same. The clients who are under your services, you will do the eligibility like you used to do. The only difference will be new people coming to your agency who never come there for any services. And that's what we call people not case managed. And that's a good advantage also because the group will benefit from the portfolio of services available to your agency. Maybe they didn't know before that you have linguistic services, the medical transportation, but by coming to you and asking for assistance with the Ryan White eligibility applications, and they use the opportunity also to educate them about some of the available services. And then after all, if they don't want any of the services you have, you just want assistance with the eligibility process, then you process the eligibility. And like we said, for the service utilization, the data will not go under your medical or non-medical case management. You're going to record the service utilization under the psychosocial services because that group will not be requiring any acuity, any other standard included on the medical and non-medical standards. So to avoid any confusion, so those who will not be case managed, you help them fill the application and you key the service utilization data into psychosocial services. There is no confusion between 24 and the 20 month. VDH and is going away from 6 months and going to 24 months. We never had eligibility and for 20 months. 20 months was like to renew the eligibility. The recertification was 6 months, and the 12 months is to start over. Instead of starting over at 12 months now, you're gonna start over at 24 months. So that's the big difference. You will not do any recertification in between. You will just do the client's access review.
Okay.
And just to
go ahead, Jonathan.
Yeah, thank you, Camelia. Sorry about that. And just to follow up with that, with some more points of clarity, the case management assessment and acuity scales, you can also, because of that scaling determines how often that you engage your your client, correct? And so that also serves as other opportunities to establish client access reviews. So it's not changing that process, but it's also enforcing that ability to make sure that the information that you have on your client stays accurate and updated. So even if you have to only see them once a year, if they come in that 12-month span, that's a perfect time for you to get a client access review. And it will not impact their eligibility assessment date, which is still will be 24 months from their first initial assessment.
Thank you for clarifying, Jonathan. Okay, why are you requiring consumers to go to agencies? That's teaching learned helplessness. Why can't we simply handle eligibility on our own like we always have?
Yeah, we have some issues there, and the data is showing, the data we have is showing that most of the clients who are non-compliant with the eligibility requirement are not case managed. It's like those are case managed have better outcome on the eligibility status that those are not case managed. So that's the basic data we use, and to help us to to streamline the eligibility process and making mandatory from April 1st all consumers to go through an agency to get their eligibility done.
Okay, what can be done when assessments are submitted through the Provide portal and it has been over 3 months for them to be approved?
So we don't have any data on the Provide yet. The 3 months or we're talking about is from the old system, and where people submit paperwork and the paperwork is piled on the office. The time to get it, it's maybe past the 14 days. That's one of the benefit of the Provide, and will remove the paper tray and quickly and help everybody to see the application material you have there. The other side, I just want to say, because I'm monitoring that, I've been involved in several quality improvement to look at the completeness of EDAP applications. And I have data and proof that many of the providers submit incomplete applications to the system or to the VDH. And some people thinking I have 1-2 element of the application material. If I submit it, maybe I can get the approval as quick as possible. I've been advising people, the rush of submitting incomplete application will further delay the approval process, because there is the bullet you need to complete. You need to have the residence, you need to have the insurance, you need to check on Medicare portal, and you need to be able to check the income status, have all the documentation uploaded. And then you can expect that your application will be reviewed and approved on the setup deadline. If that's not the case, and then you're gonna delay further because the time to reach your application and to find it is incomplete. If I just take like 14 days, because that's HRSA is telling us, and that's the guidance from the federal government, 14 days. If on the 14 days they just got your application and they find out it's incomplete, what they're gonna be doing? They're gonna just reach out to you to ask you for supplement documentation. And how long it's gonna take you to collect that from the patient? Maybe 5 days, maybe 10 days. Then you add that to your 14 days, it takes you already to 1 month before the application is approved. So the information has been out there. We're reinforcing that and educating all the providers. Please make sure you collect all the needed information. There's a checklist. Just be sure your checklist, everything on the checklist is at your hand, and upload them and expect now a quick expedite, approval of your application. If not, you're gonna delay the approval process. So that's just I wanna point it out there before we move on. Thank you.
And I would reiterate everything that Safri is saying. There are too many things that do come in incomplete at this point that just cannot be processed. If there is an assessment, and I know for certain there's not any that I see in queue that are over 3 months old. So if you put in an assessment into Provide 3 months ago and you think it hasn't been processed, if you put it in through the web portal and when you use that confirmation number to check and you're not getting anything, I need you to contact the eligibility hotline, or you can call me directly if you like. Let me see where yours is, but we don't have anything that's sitting out that is that old that has not been either approved or rejected at this point. Now, I do want to remind everyone that once unified eligibility starts on 4/1, the idea is that the subrecipients, you will now be responsible for doing the eligibility. VA MAP is not going to check behind you to make sure your eligibility is correct. VA MAP is going to be checking only the medication access piece. So you need to have all the components that are necessary to determine that medication access. You need to have all of that correct in this assessment. So what do I mean by that? You need to make sure insurance information is there. Those insurance questions have been answered. You need to make sure that you've actually requested medication assistance, premium assistance. All of that's tied together for medication access. All those components have to be there or it is going to hang up the process. Same thing that happens now, but we're actually reviewing full eligibility right now until we move to unified. But once we move to unified, internally, we are just going to be looking at this from a medication access standpoint.
So, and I know we're wrapping up for our session, so just want to continue to reinforce that particular thought. And April 1, 2022, eligibility will be in the hands of our subrecipient. What that means is that you all, when you put in that the eligibility assessment and Provide, you are making the determination that this client is eligible for all Ryan White services. There was no longer a separate VA MAP eligibility process, which Kimberly Ely just talked about. So that's the point of unifying this process. We saw, as Safri explained, in a lot of our QIPs that we had a lot of success with our subrecipients being able to have their client eligibility and recertification rates to be a lot higher than our VA MAP eligibility recertification rates. And so we are really going to support that system, as I said in my part of the presentation, of the subrecipient being the best door for our clients to access all the Ryan White services. So when you're thinking about eligibility and approvals, that really is going to rest with our subrecipients. What this does mean as a subrecipient, you will now have to make sure that you have all the documentation and necessary supporting documentation for eligibility when your services coordinators come and do their site visits. They will also be able to check throughout the eligibility process. They'll be able to do desk audits for you to make sure that you are having all the necessary documents. And when you say a client is eligible, you have all the supporting documentation to prove their eligibility within the 24-month eligibility period. So just want you all to realize that that's where we're going, that we are really putting the best way in, for client access to services in the hands of our subrecipients, and we will be here to support that process, as well as we'll be doing a lot of assessments to make sure we get feedback from our consumers, our subrecipients, and the like, to make sure that we are filling all the cracks in this process as we continue this journey together. So thank you so much for this time together, and I'll turn it back over to Camelia.
Thank you, Jonathan, and to everyone else on the panel, Safri, Ashley, Kimberly, Ely. Just want to thank everyone for submitting your questions and furthering this dialogue. Up next, we will hear our closing remarks from Mary Browder.
Good afternoon. As we wrap up day one of this year's Quality Management Summit, I'd like to thank all of the QM Summit organizers, presenters, and participants for sharing your expertise, knowledge, and perspectives. Throughout the day, we learned about Medicaid's role in enhancing behavioral health services in Virginia and heard consumers' perspectives and experiences on living with HIV and navigating mental health and substance use services. UVA provided valuable information on Cabenuva, and VACAC helped us understand their role in promoting and supporting client treatment and engagement. HIV Care Services provided updates on the Provide data system and unified eligibility. It has been a full day with the promise of much more learning tomorrow. Before you go, please complete the evaluation. Your input is vital as it helps us understand what went well and where we can make improvements to next year's event. Evaluations also give you an opportunity to provide ideas for future summits. The evaluation QR code is on the slide. We will also mail the evaluation to you. We look forward to seeing you tomorrow as we explore and learn more about improving the quality of Ryan White Part B services. Have a wonderful evening.